So there you go again. So hello guys, Kev here again. Uh, the last video that I took was a bit emotional because 13 November was Mukta's first anniversary of the bone marrow transplant that we did. I was a bit emotional and I thought that I should take a step back and look at the decision that we took, me and my wife took objectively. And any which way I look at it, I find that the decision was probably wrong. A few of the people would say that I am blaming myself and I'm trying to carry that guilt ahead in my life, but that is not the case, and I still feel not guilty, but I still feel that I should have followed my gut. That is what is, I think, the right thing to do. uh, well, what happened was my daughter Mugdha, as I said earlier, my daughter, uh, she got diagnosed with ALL, which is lymphoblastic leukemia, acute lymphoblastic leukemia, in which the number of white blood cells they rise drastically. In her case, it was around 92,000 when it got detected. Her HB was drastically low, critically low at 4.x something, which normally should be above 12 or above 14. And she was looking pale. Some kids do have fever, but she didn't have it. But she was looking pale, and that's when we wanted to. We did our blood tests. We approached one of our family doctors, a close doctor, and he asked us to carry out some more tests to ensure that none of her organs were damaged. Uh, uh, and what we found was that it was cool. She was in good shape overall, apart from the fact that she had 92,000 WBC. They call it abnormal cells. So what happens is it's a mutation of the bone marrow. There is some genetic mutation that happens due to which the bone marrow produces high number of white blood cells, which are called tumor cells or abnormal cells in ALL, acute lymphoblastic leukemia. And then the patient slowly, the health of the patient degrades. Her stamina was down. She had headaches, minor headaches. Then she couldn't walk. She got tired quickly because of, obviously, her HB was down. Her platelets were a bit down. uh, Later on, what we decided later on, when we approached a hemato-oncologist, we also got to know that yes, it is correct. The diagnosis was correct, and then we did. I think her bone marrow biopsy was not done at that time because it was obvious that she had that problem. So we started with the induction phase. So there were different phases, like induction phase, and then there was another phase of strong treatment, and then there was another phase of even stronger treatment because she was a high risk patient according to the doctors, because she didn't achieve remission in the induction phase itself. So in case of leukemia, it's a very common. I felt by looking at the number of patients that were getting admitted in the pediatric ward, that leukemia is a pretty common occurrence in childhood. Leukemia is a pretty common occurrence nowadays. I don't know what the root cause is, but it's a genetic mutation that happens. And because of that, the child gets the cancer. Mugdha was 12 years old, or rather 11, more than 11 and a half, 11 years and probably 8 months when she got diagnosed. Uh, when we So I was talking about the bone marrow transplant. Coming back to the bone marrow transplant, what happened was that she didn't achieve remission in her first induction phase. So it was called refractory ALL. That is, refractory ALL is like something like cancer that doesn't get cured in the induction phase itself. So there are like 4 or 5 medicines that are administered, and the cancer doesn't go away even after then. And so the doctors have to give even stronger medicine. So we spent like the first 3 weeks after her diagnosis in the hospital. We went through the induction phase, and then we had to do like uh, onco daycare, attend onco daycare for some of the chemotherapy sessions, and then we did the first bone marrow biopsy. That was when we came to know that her blood was clear, uh, her WBC count was normal, platelets were normal, HB had gone up, everything was normal, but her bone marrow, she had 67% blast cells. So yeah, so that's the blast cells is the name that the doctors count, and she had like, so out of every 100 bone marrow cells that were analyzed, 67 cells were tumor cells or cancer cells. That's when the doctors said that she was a high risk patient because her cancer was not going away. She had not achieved remission. The I think the count for remission is like 0.01%. It has to be less than 0.01%, and that was not the case. So the doctors, we went for, she was categorized as refractory, high risk patient. We went for another round of chemo, post which her blast cell count from the bone marrow was 3%. It came down to 3%. We were really happy that it was working. Uh, after that, she had to go through another stronger chemotherapy round because it was not less than 0.01%. So since it was a stronger dose of chemotherapy, uh, we admitted her. She was there in the hospital for straight 19 days. She was fed up. We were all fed up. Uh, all our lives were disturbed. Her grandparents were disturbed. Me and my wife both were really feeling down because of that. Uh, so we got her home after 19 days. Her bone marrow biopsy was done later on, and we heard good news. It was down to zero point 0.0. The blast cells, the cancer cells, were down to 0.008%, which is like insignificant. And she was in remission, and hooray to that, and we were very happy. But then it came to the next phase, which was the bone marrow transplant. And I will explain to you about the bone marrow transplant in my next video, which you will, video number 3 that is coming up. The size of the videos are really high. I need to upload those now, and then I will, talk to you about the actual bone marrow transplant and the process for the bone marrow transplant. Cheers. It was nice. मन हल्का हो जाता है बात करने के बाद. I thought that it will be helpful. I just wanted to give you a background of what happened. This was in the year 2017, from June to September, June, July, August, September, October, 5 months, in the first 5 months. Uh, okay, that's it. Goodbye. Cheers. I will talk to you in the next video, which will come up probably in a few hours. Thank you.